I'm the founding executive director for Stand Incorporated, which is the home of the door. We'll be talking a little bit about both of those initiatives during this talk. I've been around for 25 years as it relates to the business side of Stand Inc. and Home of the Door. I've been drug free for 39 years. So I am definitely a senior resident on this call. Been around, sit in the little chairs. I'm a 12-stepper, so I sit in the little chairs in the West End back in the day. I am also a certified addiction counselor, researcher, clinical supervisor, those kinds of things. I'm also a board member, commission member for the Georgia Commission on Family Violence. So that's a little bit about who I am, and I'm happy to be a part of this. I want to lift my hat to the council for being progressive, and they're thinking about taking this step forward and allowing us, Tarusa and I, to spend some time with you all this morning. Thank you.
Thank you, Mrs. Sperling. Tarusa.
For you.
Good morning. Good morning. I am Tarusa Stewart, and I just want to first and foremost just piggyback off of what Mr. Charles had to say, was that I thank the council as well for being able to have an opportunity to partake in this webinar. I'm super excited about that.
Cups from the hotel.
I am a woman in long-term recovery, and what that means is it is February 13th, last week that passed. I made 23 years in recovery, and I'm just super excited about that. And I am the Chief Executive Officer and founder of I Hope Incorporated. We are housed in Warner Robins, Georgia. First location, we was fortunate to do a second location in Fort Valley, Georgia. And I'm excited about this opportunity, and again, and just the Georgia Council for carving out something for Black History Month. And I'm especially excited about being on here with one of my predecessors, Charles.
Laree, you muted.
Oh, thank you. Thank you, Tarusa. Reggie, if we can move forward with a poll question.
Sure. Okay, can everybody see that?
Yep, we can see it.
Okay. We just want to know who's here, so whichever one of these apply to you.
All right.
I don't see the poll.
Who said
Do y'all
that?
see it?
Yes, I see it.
We have like 67%. Okay. Probably about 5 more seconds because we're up to 93%. So I'm sorry, 67%.
89. It's going up.
All right.
Okay, so we have 93% cares, 1% who are interested or aspiring cares, 9% clinicians, 6% are recovery allies, and 13% are others. I'm interested in what those others are.
I don't see anything on the screen.
I'm gonna end the poll, share the results. There you go. Can y'all see it?
Yeah.
No, I don't see anything.
Most of us see it. I'm sorry you can't see it. Does everybody else see it, or just nobody sees it but me?
Yeah, okay. We can see it.
All right, so I wish that maybe we can find out some of the others. So if y'all can put that in the chat box, put, other treatment providers. I just want to give it up for the clinicians, the aspiring cares, the recovery allies, and the others. And 93% are CPSADs. That's amazing. It's amazing turnout. I thank you, everybody, for being here. So we want to go ahead and get started. We want to hear from Tarusa Stewart. She's going to answer those questions that we just spoke about. What was your efforts? You know, here are some of her challenges, some of the barriers, and some of her successes.
All
Thank
right.
you.
Thank you. All right. So I hope I'm coming through well. If I don't, let me know. I'm getting a signal about my bandwidth. And so I don't know if that's me or somebody else, but if I'm coming through all really well, I am excited again to just be able to share some of my humble beginnings, and they have been very, very humble, for lack of a better way to say it. And so it started with really becoming a CARES, right? CARES 9. So I want to represent that. And which means that I got introduced to the CARES Academy in 2013. And I believe that was their third year of beginning this work. And so I was just real fortunate. And I was really fortunate because I think when I became a CARES or CARES 9 is when it became a Medicaid billable process. So, I came in really, really quick. And so getting to be a executive director and a founder started with first getting some education on the peer workforce movement, because I didn't know anything about it. I didn't know not one thing about it. I was in recovery about 11 years at this time. And when I got introduced to it, I realized it started like back in 1999. And I was like, wow, where was I when this information was being disseminated? And a big part of that was not for any reason, but it was so new. And I just felt like the information wasn't quite trickling into some really, really rural areas of Georgia. And so that would initially spark the passion to start this work. When I left CARES on a Friday and driving back down to Warner Robins, I knew then that I wanted to take what I was exposed to and help be a conduit and expose it to other communities. I wanted people to know what I just found out, And so again, when I did the CARES Academy, it just, the irony of it is Mr. Charles was doing the ethics. We were in Mary Hall Freedom building, and he was doing the ethics, and it was an awesome team. I was just blown away by every day, every session. And it equipped me for the challenges that came with the beginning of starting the RCO, because it challenged my pathway. Well, it didn't challenge my pathway per se. I'll never forget George saying, we're not asking you guys to get off that pony you rode in here with, right? But it challenged a mindset that I only was introduced to in my recovery. And so that built the bridge for me to go back into my community, right? Which I need to say, it was that Friday, I want to say the next following Friday, where they said CARES show up, the Georgia Council showed up. I was working for a community service board, and I had, the director of the Georgia Council at that time, and it was Owen Doltry. It was about 6 of them that showed up. Can't remember all of it is, but we had a meeting. The community service board I worked for at that time had a meeting. They were really, really interested in this peer workforce movement. And they was really, really interested in what could I do now with my certificate, right? With my certification, how can we incorporate that into the work of the community service board? So CARES showed up for me from the beginning, right? That was a big part of the foundational steps to that, specifically I could get into, in 2014 is when I began doing some listening sessions. And when I say it was also inclusive to the RCO development team then. And I don't even think it was called that. So in 2014, I began having the listening sessions in Fort Valley, Georgia. And at the time, it was the Honorable Mayor Barbara Williams, and she opened up the City Hall on a Saturday. And she allowed us to come in And she allowed some community members to come in and talk about recovery and talk about wellness, you know. And at that time, a big part of that support came from Tony Sanchez and James Godfrey, right? They were spearheading, you know, looking at helping us bring recovery into our community. And so she would open up the doors on Saturdays, and we would go in and we would have these focus groups and just conversations. And I was just really, really blown away about, you know, people interest in recovery. You know, it started with National Recovery Month events, right? So like I left CARES in April 2013. That September, I had my first event, right? I was planning it in my head on my way back from the training. I knew where I wanted to have it. I knew what I wanted it to look like. And the first event was in September of 2013 in Fort Valley, Georgia. That was the mission. That was the vision at first, was to open up an exposed, you know, like I said, the rural community down there. And so that was what that meeting was about Friday. It helped shape that. The mini grants was out. I applied for mini grants. I got my $2,000 and I ran with it, right? And and I ran with it. And we got some bouncy houses. We did what we could. We got some t-shirts. And we rallied in the community, you know, and we got a police escorted parade down in this little town in Fort Valley, and people were coming out their business saying, what is this for? What y'all doing? What this is about, right? We just making noise in the community for recovery, you know, and that was some of the foundational stuff. The building trust and engagement kept because it had to continue to show up. You know, we had a symposium, 2014. We did at the 2014, we began a planning session to do a symposium, and they was just beginning to do symposiums through the Georgia Council, and it was with the awesome Dr. Deetra Hawkins, right? Was a great part of that foundational beginning. And so we did a symposium. It was called the Middle Georgia Recovery Movement Symposium, and I think the movement part was intentional because it hasn't stopped. Right? Whether I wanted to or not. But we had this symposium in 2015, and Dr. Hawkins was there, and we did asset-based community development to our community. And one of the things that I loved was what helped frame that was we went into our community, kind of like what you guys are doing now, and we didn't say we got something new or better or the best. We assessed our community for what was working, right? What could be better, what keeps you hopeful around recovery. And so, and out of that came, the following year I started coming back to the table. Out of that came our board of directors. It came some more meetings. It came bringing some intentional people back to the table. And what developed out of that, what was a success story out of that at that time was that people kept showing up a year later. At this time, I began working for the Georgia Council. I mean, not the Georgia Council, the Georgia Mental Health Consumer Network as a forensic peer mentor. It was a pilot program at the time. And I was working at Baldwin State Prison. And so one of my success stories was that we would have meetings every Friday, right? Shout out to George. I seen him on here. George showed up every Friday with some other community leaders and community allies. And it really started with allies, you guys, in my community. I need to say that allies showed up mostly because they had loved ones they didn't know really what to do with. And so the allies is the ones who rallied around it in the beginning for us. And we had this meeting the first Friday of every month. And, you know, in the back of my head, I kept showing up because I wanted to see who was going to stop showing up. And what happened was they kept showing up. And they kept showing up. And they kept showing up. And so the success out of that was 2 years later, after the symposium had happened, was I had to make a decision. I had to make a decision to maintain the integrity of my employment, right? Because I was working at the Georgia Mental Health Consumer Network, but the community collaborations were growing at that time. And the people were still showing up for the meeting, and I had to go to my husband and make a decision and say, hey, I think we're gonna do this I Hope thing. I think it keep growing. I think this is the way we're being led to go. And we're gonna go down to one income. And he gave me the green light, and I resigned from my job, you know, of course, the proper way. And I had no funding, right? It was no funding. It was no money. It was none of that. It was just people showing up who shared a common passion that I did in my community. And that was enough for me to want to say, okay, let's do this. You know, I need to say that the very next month in October, so I left my job September 2017. Yes. In October 2017, at that time, the Georgia Council called me and they said they had got a B Corps grant, and that they wanted me to be, I hope to be a part of that B Corps grant. So it was that very initial seed money from doing the work that helped us early on. I want to say that was a faith move. Here I go, I'm working out of my job September and October, I get this small amount of funding, right? That was enough to sustain early on what we were doing. I think, sustaining momentum. We started continue canvas in the community. It wasn't always a big group. I need to say sometimes I rented out. When I say rented, it didn't cost nothing, but it was spaces in the library, right? In my local library, they would give us rooms, and we'd go in there and I would just make up these flyers, and I was trying to get buy-in. And sometimes 2 people would show up, sometimes 20 people would show up, but I was still presented, right? I was still looking for that buy-in no matter how many people showed up, and they just kept showing up. My board of directors, the name, everything was a participatory process, because that's what I was taught, right? For my community, everything was a participatory process. We played with the name. I came up with we came up with some things at the time. The I thing was like really prevalent. And so I was like, well, we need that little I, marketing or whatever. So it was me, George was at the table. We had some other people at the table. We had some community collaborations that we built very successful relationships with today, but they weren't even in the position that they are in now, but they was at the table way back then. And when they got into some community positions, they reached back and pulled us through the doors. And I'm really thankful for that too, And so, like I said, yeah, the names, everything was this participatory process. And we came up with it, and I Hope was born. I Hope initially was an acronym for Intentional Houston's Opportunity to Promote Empowerment, to target just the community or the county that we were in. Later, we came back to the table and said holistic was a better approach to that, and we changed the name. And then by this time, 2017, we had to start doing the paperwork, right? Measuring success and impact. So are we really doing this? This is going to happen? So we had to get the paperwork done. We had to get the 501c3. We had to go out to the Secretary of State. We had to do some of those things. The bylaws was a participatory process. What did that look like? Our core values. What principles that we wanted to look like. We wanted to continue to keep our community engaged in this. And I want to say for 1 year, I did this with no funding. It was, I had sign-in sheets, right? So, they tell us you can't apply for grants until you've been in business for 2 years. But I want to tell you guys, for that year that I was just doing meetings, that was business. Those years I was doing National Recovery Month, that was business. So I had sign-in sheets, people signed in. And the year after that, almost a year to the date, we begin to get some more funding through the Department of Behavioral Health. Strategic opioid funding came out, and That was our first funding source. And that came out in 2018 of May. And then September 2018, that's when ARSCs was being developed. Right. So by this time I was considered an RCO. So I did do the work to become a recovery community organization. And as they, as you guys probably know, as it focused on Georgia, it was addiction recovery support centers. And so those came in 2017 in September. And today I have 30 staff. I have a staff of 30. I have a management team of 4. And so my goal now is sustainability and a succession plan. I knew this. I knew when I was building I Hope that it was eventually, it wasn't for me, it's for my community. And so I think it's important knowing the signs and the seasons of what that looks like for people individually as leaders. I think that is good for now, Laree. I don't know.
Wonderful.
Okay.
Wonderful. Great job. Thank you so much. We're gonna come back to you though, because I know we got some questions. Thank you,
Okay.
Tarusa.
Very welcome.
Very interesting. Very interesting. I've been writing down some questions, so I got you. At this time, we'll hear from Mr. Sperling, and he's going to share some of the same things. He's going to share what helped. He's going to share. Let me pull my document up. He's going to how his efforts began. He's going to share with us what worked for him. Maybe share something about what didn't work. And what barriers did you face as a Black leader, if there were any, specifically to starting a support for substance use recovery, if there was any, Mr. Sperling?
Yeah, so again, thank you, Laree and the council, for stepping up the way you guys stepping up for this forum. To have this platform to talk a little bit about historically how Tarusa and I may have gotten started with this. My story is a little different. I was in a meeting not too long ago. It wasn't a 12-step meeting, but I was in a meeting and I talked about how long I had been drug free. And one of the participants in the meeting, she said, that's when I was born. So I know God has been exceptionally good to me, right? I mean, exceptionally good to me. And I share all the time that nothing that has happened in my life has happened because I'm so clever. That's not the origin of how all of this occurred. I am a believer. I'm a believer in Christ and have not always been, but I am. I'm a 3rd stepper. I'm a 12-stepper, and all those things coalesce around where I am now and how I go about this work. So Stand Inc., and we've been around since 1999. This is our 26th year. And you'll hear me talk about Stand Inc. as a separate part of the door. The door is one of our initiatives. Stand Inc. started in 1999, but of course, the recovery movement as we know it was probably 2014, 2013, something in that area where we got started with all of this. I'll start talking to you a little bit about Stan, and then I roll into talking about Neil and George and a little bit about how we got together with Ed Maryhall Freedom House, as Tarusa talked a little bit about, and we broke bread and debated about a lot of stuff until these things come up. I'm a CARE 35, but I was a part of the original conversation about the work, right? So Stand Inc.'s history, I am, as I mentioned before, I'm a 12-stepper. I know jail and prison from the inside out and all that kind of stuff. So when I separated myself from those kinds of activities, I stopped going to jail. So I got drug free and jail was no longer part of my story. So the question became, what you gonna do with your time, right? So I took myself back to school and I started to volunteer at the parole board, no less. I said, look, I wanna help. How can I help? And that's how that whole piece about helping got started. And I wanna say, did some graduate work and some other work academically, but I discovered that I am a servant leader. And I discovered that not just by definition, but by measurements of my heart, right? I'm a servant leader. I roll my sleeves up first. And I started volunteering, and volunteering is doing groups for parole board, but no money involved. Tarusa is absolutely right. In that way, I wasn't making a dime. I was volunteering, going down there like I had a job. And I was pouring into them. But amazingly enough, the brothers and sisters that were down there, they appreciated it, so that was motivation for me to continue. So Stan Inc., my wife at the time, her name was Faye Brown Sperling at the time, and Faye was the director for an organization called Our Common Welfare. And Our Common Welfare provides services for people who are HIV positive and also substance users. So what does that have to do with Stan? Well, Faye was partnered with some researchers over at CDC. And one of the researchers reached out to them one day because I was looking for some statistical information about men coming home from jail and prison, because that was my passion. And I want to say this up front to everybody on the call. You got to answer the question about what is your why? Why? Why are you doing this work? Why do you want to do this work? And then you have to examine your why as it relates to your passion, as it relates to your why, if that makes any sense. These kinds of things are going to be, they're going to be the drivers of whether or not you want to do this work, how long you're going to do it, and the steps that Tarusa talked about a little bit earlier. So at any rate, Judith Greenberg was her name, and she said to me, she said, "Charles, it's uncanny that you called me at this time." And I said in my articulate voice, "How so, Judith?" And so she went on to tell me that she had a research project. Here I am with a brand new community-based organization, brand new 501c3, didn't have a dime, didn't have no money. And here she's talking to me about research. And I'm going to shorten the story up because it can get long. But Judith invited me to write this cooperative agreement with CDC. We got the money. It was a research grant looking at HIV and other STDs, and looking at the prevalence of STDs in jail versus prison. Now, so why did they need me? Well, because I had a history of incarceration and I was Black, right? That's the long and short of it, because they had no cred inside the jail, none. So you say research, you go to jail, nobody's talking to you, right? Absolutely nobody. So that was our beginning. So she said, "We really would love to partner with you." And the story went on. And so here I am, no grants management experience, brand new CBO, and CDC gave me a bunch of money to do this research project. Fortunately for me, I had Judith and some other researchers to help me out. Shorten the story up, we did the research project. It was called Misters. Successfully, I started understanding why researchers do research. They want to publish. I was so naive what I thought I could bridge this outcomes of this research into practice. I'm going to take this data and I'm going to. No. They took their little papers and they wrote and published. And I was sitting there in my office. I will never forget this. All the money was 4 months from being gone. I looked up because I had no grant management experience. All of a sudden I looked around. I said, I got 4 months of money left, right? I had 6 MPH status staff folks working for me. What am I going to say to them? So I was tore up about the whole thing. I learned it was OJT, on the job training. And I went to them and said, "I've learned so much about this. I want to bridge this." They were like, "We're not interested, Charles." We did what we came to do. So I was left with that, had to go to them and say to them, "Look, we won't have a job in 4 months." It was the most miserable feeling I ever had in my life. All the money was gone. I had a decision to make, Tarusa. So I had no money. What are you going to do? Right? So I bit the bullet. I had no dollars. I went into what little savings I had, and I started doing substance abuse treatment at the time and opened up a storefront. I didn't pay myself for the first year, not a dime. People that would help me with my money, they said, "Oh God, how you doing it?" But the passion, the thing that was driving me was beyond anything I could understand, if that makes any sense. I was being driven to do all that. Shortened up the story again. So I moved into doing the work after the work with CUC, I wrote a grant. Participated in the writing of a grant, and we got federal funding for a project called Project Self-Empowerment, and another federal grant for Project Connect, those kinds of things. And so I had federal funding for, I don't know, 10, 15 years of a cycle at the time, 5-year cycles. I learned how to do grants management. I learned how to take care of all of the compliance issues that were associated with the grants. I dug into the community. I work in DeKalb County, South DeKalb, high need, low resource community. And we have been on the ground from day one. I think Stan Ink's name is in every Georgia prison that we have, because folks are calling us still today about trying to get into our treatment services. Lo and behold, I'll fast forward again. We're doing the work. I've had as many as 20, 25 people working here. I've had as few as 6. So I vacillate because you get grants. Grants have sunrises and sunsets. And I think it's important for me to say that. A grant has a sunrise when, oh, we got all this money. But you got to plan for the next grant when you get the first one, because that money is going to leave. So it's important for you not to get so excited about that. It's about surrounding yourself with, well, for me, it was about surrounding myself with people that were smarter than me. I needed people in my circle who were smarter than me, not only by their interpretation, but by own, so that I can learn from them. Grants came, grants went. So we started to move in and out of these grant seasons. We expanded, we blew up, and then we had to pare down. And that's the other thing about grants going away. Everything that you done bought, now you got to do something with it because you ain't got the money to support it. I'm giving you this insight so as you start to grow, because you guys are going to get your businesses going. But please be aware that these are some of the things that are going to occur in your process. Laree, I know I'm talking a lot, so now keep me on track. So if I
got you. You got some more time, Mr. Sperling.
Okay,
You're good.
Okay, very good, very good.
Like 7 or 8 more minutes. You're good.
So I ended up doing the work, just substance abuse treatment. As I mentioned before, I'm a counselor therapist by training, and I'm also a clinical supervisor and some other things. So I had Neil, I'm talking to Neil. Neil was a single state director at the time. She came out to our facility and she was like, I love your work, what you're doing. Let me help you do this. Let me help you do that. They have nothing to do with the CARES movement at the time. But you know, Neil is a trailblazer. So we went after trying to, we developed partnership housing. That was my partnership housing, or reentry partnership housing, because all of my work was about reentry, guys coming in from jail and prison. That was the foundation for my work. Nobody wanted to be bothered with that group. Period. I tried to get housing for them. Nobody wanted to be bothered with that group. They had a thing called Not in My Backyard. That was one of the barriers that happened then and is still in place now. So what did I have? I had to do something about that. I had to surround myself with collaborators that wanted to do something. So, and in doing that, what I do today is akin to everybody want to eat. And I'm not running from money. I'm not running chasing money, but I don't run from it. So when I started to talk to people about developing things, let's get the elephant out the room. What do you want from this? What's your ask? And then we get the elephant, we deal with the elephant. Now we can deal with what we want to do about purpose. Does that make sense? So that was my approach to how I went about doing the work. So long story short, again, I collaborated with some people who were some builders who had houses, and they weren't so scared at the time, to help me out with this, particularly if I could pay that rent. And Georgia Power really, they didn't care either because I could pay that power bill, right? So I ended up getting in touch with these folks and forming a relationship and a couple of other meetings that I had, Tarusa. I bring people together. I bring people together over food, folks. I bring people together over food. Let's go get some whatever it is. I don't care if it's pizza. Let's get some food. Let's do a breakfast, lunch. Let's do a planning meeting, that kind of thing. But we always talk about food. So we found some common interests. So I started the whole housing piece for guys. Today I got 16, 20 beds that we're rotating people in and out of from jail and prison. I've maintained those beds for a long, long time. The state of Georgia, Neil again was single state director. She was in my corner. What you need, Charles, what you need. Because the other thing that we did, I don't play with them people money. I could say this a lot of different ways, team, right? I could be really articulate and professional, but I want to say it this way. I don't play with them folk money, right? I do exactly what I say I'm going to do, the way I say I'm going to do it. Every grant that you write a grant with line item budgets, with goals and objectives. Don't run for money. Don't go after money that you know that your heart ain't involved in, because you're not going to do a good job, right? So at the end of the day, I ended up, Neil helped me out, and we started the housing piece. And later on in the process, Neil came back and she said, you know, I'm in this recovery movement thing, Charles. I said, what is that? You know, so she brought me into the circle. Her, Neil, and Owen and George and other folks. I can't not talk about this without talking about Lucy and Neil. We would sit down and come up with some of the things that were important about that she wanted to see in the recovery movement. And lo and behold, she launched it. I trained for her for a long time, but Neil also told me, she said, if you want to be a carer, you're gonna have to take this test. I thought, are you kidding me? I was a part of this from the beginning. She said, I'm sorry. Anyway, long story short, I'm CARES 35, although I was the beginning of all of it. I'm CARES 35 because she wouldn't let me off the hook. I love her though. I love her dearly. So she came over to our place. We started to scout out where we wanted to be and how we were going to name this initiative that we we're going to be a part of. Didn't know anything about it. She brought the CARES team over. We sit next door. And we started thinking about names. So we started talking about the door and the fact that it was an acronym, the CAP, Open Opportunities for Recovery. That wasn't mine. That was ours. Right? That was ours. So I didn't, not a one thing. She taught me something, Laree. And the thing that was so important is nothing about us without us. So that has stuck with me to my core, right? So I still practice the same thing today. So, you know, a couple of milestones I mentioned and kind of get out of y'all's way, but I had several samples of grants, and we got call for accreditation back in 2012 to Commission on Accreditation and Rehabilitation Facilities. CAR, so either going to be CAR for JCO. So if you're going to be in business with substance abuse treatment in particular, CAR is going to be the way to go. So why is that important? Now you're talking about compliance. You got to have all of your policies in place. There are two areas for policy. When you develop your 501, you're going to have your articles of incorporation, right? And your bylaws. Tarusa mentioned that earlier. So articles of incorporation and bylaws. And then when you keep moving your board of directors, you got to structure your board. There is a difference between a nonprofit operation and a for-profit operation. They are different in design. They are different in structure. So you have to know the difference. Remember, I asked earlier, what is your why? So if you start thinking about your why, it'll help you understand whether you want to go the for-profit route or whether you want to go the nonprofit route, right? And sometimes those two things come together nicely. But please understand your why. That'll help direct you. So we got a CAR for accredited, and we went on to move on from there to develop a relationship with our county. We are in DeKalb County, and our county has been supportive of us for a long, long time, from the CEO to the commissioners. Commissioners have written checks to stand out of their pocket just because of the work we do and where we do it, right? And we literally, anybody that walked through that door, no pun intended, when they walk through that door, the services that they get, we're able to give it to them, right? Or at least point them in the right direction. So that collaboration started with our Congressman Hank Johnson. I went to sit with him. Went to sit with him. His outreach director, Eric Hubbard, invited, went to sit down with him. He was available and I talked. Same thing with our CEO at the time and our commissioners. So that was a collaborative effort. Lastly, is faith-based. So I realized some time ago that the same people that are in our community centers are the same people who come into the door for services, right? So what's wrong with that picture? So what can we do to intervene in that? So I have several faith-based initiatives going on right now. And what the plan is now in 2025, first quarter, is to have our faith-based breakfast right next door so that we can talk about how we can address the needs of this community. Because I know substance use disorder is major in terms of the revolving door that folks go through. Mental health is major. So I know these things. So I want to help the SOAR is a wonderful way to produce a training to help the church understand, right, what addiction is all about, and the fact that we have millions and millions of people who are able to recover. Sustainable growth. So I had to have somebody to write grants, somebody to do contract work. Some of it I do myself, and some of it I partner with people who have like minds. I partner with folks to write a grant, and we are collaborators in the grant, right? So that I could be the lead in the grant, but I also break them off in terms of what they're asking for in terms of dollars and cents. You got to think about sustainability. Succession, Tarusa talked about that as well, because at some point you got to get out the way, right? At some point you got to get out of the way, and you don't want to hand your hard work and your hard work and your heart work over to somebody that's not going to respect it, right? You want to leave a legacy and you want it to continue. So if I'm leaving you with anything, it's about continuing the fight. The need never goes away. The need never goes away. Check yourself at the door. Check yourself at the door. What is your why? And once you understand your why, attach your passion, and I'm sure that God will show you what he wants you to do, right? He'll show you what he wants you to do. Because what other things that I realized is that if God ain't in it, then you got a problem from the start, right? That's an editorial comment. It's just my comment, right? So I thank you guys for allowing me to take up this part of your day, and I invite questions because I know you probably got some specific ones for us, and Tarusa and I do our best to try and entertain those. Thank you so much.
Thank you so much, Mr. Sperling. This is amazing. I do have one question. Guys, I'll do a few questions and then we'll open up the floor for other questions from the peers. So my first question for you is, you spoke about sunrise and sunsets of grants. So, and you said, of course, always make sure that the grant that you're writing is attached to your hard work, and don't be afraid to go after money, but make sure you do the deliverables. So how do you decide what direction to go into? You know, because I know sometimes it's also based on trends, what's happening in the communities. So how do you decide which direction to go in, you know, to continue to support the community?
So for me, as I mentioned, I don't chase money, right? I just don't chase money, right? I look for grants. I'm part of that whole grants.gov piece. I'm on the counties where I'm all over foundations everywhere. And Laree, occasionally I found a grant or a contract that lines up exactly with what my hard work is at.
Okay.
Right? And then I got other people looking as well. They say, Charles, this might work for you. Take a look. And some of it is, yeah, it might work. So I get to writing. Or say, no, that's not for me, right? Because it's asking me to do some things that that's not where my passion is. It might be where your passion is, right?
Mhm.
So people say, you know, you work on your passion, you never work a day in your life. Well, I don't buy into that. You're gonna work. Well, it's about whether you're passionate or not, you're gonna work. So you need to find something that will really help you get out of bed in the morning, right? And sunrise and sunset simply means that most federal grants are on 3-year cycles or 5-year cycles. Most of them, right? So you know when you get the grant 3 years, you know that grant's gonna be gone, right? So you got to start to look how you want to replace the work, because you're gonna start some work with that grant. Because you told them people you're gonna look at babies that are blue-eyed and black hair, or whatever, for the next 3 years. So you want to continue that work. So now you're already looking for grants and contracts or other relationships that will help you do that. Did that answer your question?
It did.
Okay.
It did. Yeah. Tarusa, what about you? How do you continue to work? Because you've opened up a second site, just like Mr. Sperling has done. He's branched off from Stan and started the door. You started with I Hope, and now you have another project that you're working with at, I believe you said Fort Valley. So tell us how you came to do that and what that's about.
So, just piggybacking off a lot that what Mr. Charles have said, right? You have to, first of all, it needs to line up with your mission and your vision of the organization, because those are some of the things that you sit down and you don't change. And that does come from a heart place. It comes from a calling. It comes from a place of collaborations with your board of directors and your advisory team and all these people in your community that you're working with. So it's essential that it lines up with your mission and vision. Another thing that I would add is that also when I look at grants that are coming out, I look at the capacity. Do we have the capacity to commit to a grant at this time? Does it recycle? So maybe I don't need to apply for it this year. Maybe I see what it is, and we could try and equip myself and build collaborations for the next year. Right. And then especially you want to look at making sure those are heartfelt relationships in your community, because like Mr. Charles said, it'll begin to feel like work when people start backing out of the commitment. So you want to make sure what spirit of cooperation are these collaborations in your community, right? What level of mutuality is it? Is it a true collaboration? I'm going to do this, I'm going to do that. Do we have memorandums of understandings in place? Do we have memorandums of agreements in place? I like to do things in writing when it comes to that, because like it was said already, it comes with line items, it comes with deliverables, it comes with a commitment. And if Tarusa Stewart name is going to be on the contract, we're going to do our due diligence, right? It's not just about the money, but it is about the money, because it helps us service people in a different capacity, right? In a better capacity. And I'll end with this. For I Hope, in an area we're in, I'm passionate about filling gaps and not duplicating services.
That's good. So
we want to be gap fillers. Our transportation, that's how we started. You know, we got New York University came and gave us some funding because they love the peer model as far as the transportation in rural areas. That's an essential gap filler. You know, I know there's housing needs in our community, but I don't feel led to write grants for housing needs. You know, so even my staff would say that, hey, we got this, we got that. I'd rather get with the community service boards who have the Georgia Housing Voucher Program, if it's still in effect. You got DCS who have projects, you have Recovery Home. How can I get them around the table and we collaborate and we fill a gap to that, right? Because again, I don't feel like now the second location you mentioned, that birthed out of passion can be birthed out of your initial passion. And that birthed out of having some families and they're having transitional age children in recovery, mental health challenges. And I just know that, everybody don't have to go to the levels that I went to, and that early prevention, early intervention, and I know that's clinical language, but sometimes there is a higher level of services somebody need. How can we be more intentional with that And so with the youth and family tree, 14 to 25 years old, we had to collaborate with some clinical services in our community, right? And they did, and I got to, like Mr. Charles said, sit down at the table and be real intentional, and know that don't take nothing away from me being a peer supporter and having an organization that's peer-led, peer-ran, peer-directed, right? And you can still have that clinical component where if you have a young person who needs those services, right? And so we expanded it. We got a CPSY. I got a CPS, I got a certified peer specialist youth, and I have a certified peer specialist parent. And so when I knew that we had those peer modalities in place, then I could go after those grants now, because I can still keep it peer support, right? Because I feel like that's the lane I was called to. Even as a, you know, a CAC, which I maintain that, but that's not the lane. I think peer support is where I'm is where I'm supposed to be, is where I love to be. And so yeah, so as far as that money, and yeah, you have to be vigilant. Integrity, I hope we had did an audit before we was getting money. Just because we was in year one, we started an audit. I ain't had nothing to be audited. I was like, I don't know, let's get an audit, you know. We getting auditors, right? and if I could leave y'all with something, because I can't get confused about this. If money was a trigger for me, you need to put as many things between you and millions of dollars, if that's what you need to do, right? Because eventually you'll be handling millions. I know I ain't where Mr. Charles Sperling is yet, but
yes, you are.
But you need to have things in place, because I'm still a woman in recovery, and my personal recovery is not a boomerang. It doesn't boomerang from the work that I do. The work I put into iHope does not boomerang into my personal recovery. And so, yeah, you don't want to you don't want to chase money, but if you do the right thing, it'll chase you.
Wow. Oh, that was amazing. Okay. All right. Money chasing us down. One more question I got. What would you say would be one of the first steps? Okay, we're here today. You're looking in the chat. People are inspired. What would you say would be the first thing that you would want someone who's hoping to do this work? What would be their first step? We can start with you, Tarusa. What would be their first step leaving here today?
Get buy-in. If you have a first step, get you a one-pager. It's a formal name for, I think, is a charter of accounts. No, that may not be right. That's accounting, but it's a charter. I think it's a one-pager, and formulate that, something that even if you go and start getting buy-in from your community, from the recovery community. If you're in recovery, you already have some type of relationship in the recovery community. Guess what? Some people in that community are called to live their recovery out loud. They just didn't know it yet, right? And so start doing that. But then when you talk to people, have something to leave in their hand, something that they could go back and that they could reference to, that talks about exactly the specifics of what you want to collaborate on. Set up a meeting, free spaces like the library, like I said, and say, hey, come and show up. And don't get discouraged if it's just one or two people that show up to the meeting. And so yeah, go for the buy-in, build those relationships, cultivate those relationships, use sign-in sheets, right? And just keep letting it grow from there, and stay consistent. Don't show up, don't schedule meetings and don't show up.
Thank you. And I love that you said have a sign-in sheet for everything you do. I haven't heard that before. I haven't heard that. So yeah. Mrs. Sperling, same question.
Well, I think data drives a lot. So I would be in pursuit, first of all, being able to know where my passion is, what I see, where I see I want to spend my time and energy. My next step would be to find the data to support that need. There are a lot of data platforms out there now, depending upon what you're trying to do, but there's some data out there for you to harvest and put on your one pager. right? This is my why, and this is what's going on, and so that's one of the things that I would do. In addition to what Tarusa talked about earlier, is to grab that data set or those data that would relate to what you're trying to do. I love the idea about the sign-in sheets. You're absolutely right, because that's another way you're collecting data. You're collecting need data. You're collecting the number of people that are interested in this. Next time you talk to somebody at your mosque or church or whatever, you said, I had a meeting. I had 15 people at the meeting. And at the meeting last Thursday, it would be wonderful to have 15 from the mosque to show up. Just think about what we could do. That kind of conversation. So that would be lastly, finding people with like minds, finding people who share your interest. Some of the people told me a long time ago, and some of this educational stuff I was doing anyway, they said you got they color coded it. They said you got people that look up to you for knowledge and information. They call them your reds. And they said you got people who are you on peer level with. They call them your blues, right? And then they got people who you wish you could be as successful as they were. Right? And so you have to know where you are in that way. And the next thing I would say, if you can get them to talk to you, 15 minutes, you have to know what you want before you go in the door. People say all the time, Mr. Sperling, can I come by? What do you want to talk about? I just ain't got, you know what I'm saying? It's like you want to just chop it up. No, if it's something you want, I am free with information. I'll let you know exactly what happened, but I ain't got the time to spend the day. You know what I'm saying? I don't. So I'm saying know what you want, and it's not me being arrogant or none of that, right? I'm probably one of the most humble men you will ever meet, in my opinion. But when you go there, know what you want. If you're gonna knock on Neil's door, know that these are the questions I really need answers for. So that's my response to that, Laree.
Great. Thank you. So guys, we got them here. They can answer your questions. We got about 15, 20 minutes for questions. You can raise your hand and we'll start calling on you. Now I can't see them, so I mean, can I? Because if y'all don't come up with some questions, I'll ask some more questions. Okay, Aisha, can y'all unmute her? Or
Hi.
Okay. Hi.
I thank you so much for such a wonderful presentation. It definitely is always like really inspiring to hear, even if it is terrifying when people take big leaps to do work that they feel called to. I'm a certified peer care 60. I work at the University of Georgia. I'm a certified peer at the Health Center, and I run a collegiate recovery community. And something that I've been encountering that I'm interested to ask Ms. Stewart about is this idea that like navigating doing clinical collaborations. You mentioned that. I work with the Health Center a lot for counseling supports for people in recovery, but there's been a question recently, kind of not to invalidate peer support as work, but like push towards, well, you should get your CAC, you know? Like if you're gonna do this kind of collaboration, then you need to have that. And I was wondering if that's something that you've found to be necessary, if you've had this kind of advocacy conversation for yourself and your organization. What motivated you to get a CAC? Or like anything along those lines?
Thank you. That is a great question. Is Aisha?
Aisha.
Yes. Thank you. So just to put it in context, I had the CAC before I got introduced into the peer workforce model, right? And when I got introduced into the peer workforce, I knew that was truly my lane. I think, and Mr. Charles also speaks to this, a lot of older organizations are grandfathered in because the peer movement didn't exist, right? And not only did it didn't exist, it wasn't the information wasn't getting out into all areas, right? In a timely manner. So no, the question really is no, I don't think you should have to have it. I think that if that's something that you want, is a personal aspiration, go for it. I would never tell nobody not to. I've had plenty of people, and Laree probably could attest to this, and kids who go on to other things. And this has been the foundation. But do you have to have it? Absolutely not. And I'm gonna be real transparent right now. I'm up here in the training, and I'm like, okay, we do this. This is, I mean, we on it. Like, let me tell y'all, do not sell yourself short with the lane that we have been gifted. We are making power moves, and I feel like they just reworded a lot of the other stuff to we're already doing it, right? And so when the clinical model came out, it was about in the beginning, and we learned this early in cares. In the 70s, it was about recovery. It was about disorder. It was about being trauma informed. And then it went to the medical model, right? And so out of that birthed our lane. And it is needed. It is so much needed, you know, and I'm just team peer support, right? I am team CPS, but I also had to be open that there are some people that still come into my facility that may need a higher level of service, right? So why not have that collaboration, right? Why not have that mutual respect? And so that it could still be both and not either or.
Yes, thank you, Tara. I love that. Yes, absolutely.
Thank you. Thank you. Another question?
So I want to share what Teresa, this Vanya,
Hi,
because
Tanya.
that was my same thing when I've been in recovery over 30 years, by the grace of God, one day at a time, right? I'm a person of long-term recovery for that long. And one of my dreams is to start a couple of recovery houses, probably not here. It's needed in my hometown of Daytona Beach, Florida. But at any rate, what you were sharing, Teresa, about I was like, I want to do this work, but I don't want to have to freaking go to school and get a degree and all that. I'm smart. Don't get it twisted. I graduated with honors. I can do it. I just say have the discipline or you know what I'm saying? I like that just ain't gonna be I don't know what I'm gonna do, God, because and so I did attempt to enroll in school, but to your point, I was so grateful for CARES, man. I was like, thank you, God. There is a way to do what I want to do without having to go to school and get I did go to the training with Miss Kelly back in the day, you know what I'm saying? I did that part, but I just couldn't see I was like, I was not feeling it. So to your point, I'm so grateful for CARES, for the peer-led, movement, because man, I'm in my lane. So thank you for affirming that for me and sharing that. I appreciate it. And
I
also
love
to the
what
respect to the counselors, like you said, I do utmost respect. They do what they do, we do what we do it together. And I love the fact that it's both and not either or. That definitely hit me. Thanks, sis. I appreciate that.
Yeah, I love that she said that too, because I find a lot of times it's like people feel like it's us against them, and it's not, and it shouldn't be, So, Mrs. Sperling, you want to answer or speak to that as well?
Well, yeah, I mean, I can speak from my experiences. I found it not only gratifying but rewarding to get myself back in school. And I got back in school and finished some graduate work, and I'm now in a doc program. I'm a career learner. That's what I do. I love to turn pages, and so both because that's what's real. Remember now, I run a clinical program on one side of the house, and right next door is our peer support work. And these two groups of people meet once a week to talk about the clients that are part of this program. And it could not be better. I have a housing program where our peers are on phone conversations of telephonic peer work that is a part of what they do as well. So I see the benefit of both of those. I'll share this anecdotal kind of experience that I had earlier. I was working in a treatment center back in the day. I was working in a treatment center, and there was a guy. His name was Omar Wally Marshall. He was a psychologist. He walked into my office one day, and he said, "Charles, he's looking all around on my wall. He said, "Where's your degree?" I said, "Omar Wally, I don't got no degree. I got 5 years clean." So he turned around. He turned around and walked right out of my door. but he came back to talk to me about that, right? And he was one of the catalysts for me to continue learning. And that's not for everybody. You know, it's not. Peer work is superb. I mean, and a lot of folks would not make it without it. So, you know, so that's my contribution, Laree, to that question.
Thank you.
I love
right.
it. Say, where your degree?
Degree.
Yep.
Got 5
Miss
years
Bev-
clean. What you mean?
All right, we're gonna call on Miss Beverly next. Beverly Ragland.
Thank you. This has been an awesome webinar. I've learned so much. My question is related to community and engagement and building trust in the communities. So when you go into a community, what strategies do you use to engage the community and to develop trusting relationships so that they support the work that you're doing?
I'll comment if you don't mind, Laree.
Go ahead.
So we back again. You know, I am been around for a while. We used to use this expression, gatekeepers, community gatekeepers. We used to use that expression. So whenever I'm planning a meeting, Beverly, the first thing I would do, or one of the things I would do, is find out who those folks are, and I make sure that they're there with me, right? I make sure that those are the first person that I want to engage, is to find out who that gatekeeper is, that person that the rest of the community will listen to. In some instances, if it's grassroots, that's a different gatekeeper from that spiritual gatekeeper who might be a preacher, minister, imam, so on and so forth. So I may need both of those. So I do the preliminary work to find out who those gatekeepers are and ask them to help me promote this event. Because the next thing, as I mentioned before, I love to bring food to the table and meet with people over food. So that would be my contribution to your question.
Thank you. Tarusa?
Yeah, I want to chime in. And I don't know I don't remember the instrument name, but however, it was in my bio. But one of the things the B Corps has really helped us with that too, Ms. Beverly, and specifically the Wilder inventory, which was an instrument that we used to kind of measure the collaboration with the community. And we asked them to do a survey based on how did they see us? Did you see us as credible a resource in the community? Do you know, and it had many different scales, and it could be measured. It was evidence-based, and we had I think a doctor from the University of Georgia on that. And that was a lot of work though. It was, you know, so one, if you could get your community collaborators to do that survey. They did it over a 6 months time. I think it was initial and then 6 months, right? And that was me early on. So what that gave us insight on was the expectations, you know, the level of, and we did the asset-based community development. Intentionally, where do we feel like we want to collaborate? Is it just a spirit of cooperation? Are we, thank you, George. He put it was the Wilder collaboration factor inventory, right? And so is it in the spirit of cooperation? So yeah, we share the common goals, but I don't necessarily want to directly collaborate with you, but maybe when we do events, let's get together. Right. And it's kind of like what we do with our peers. We had to meet our collaborators where they are as well, you know, and that really helped us go a long way with building those. And for us, and I hope again, and I want to say stay in the course, because they're looking, they know about Charles talked about the gatekeepers, but then you talk about those silos, right? There has been grants and dollars that has been around way before I hope. And so some of them are watching. They watching to see where is this going? You know, where's the credibility of this organization? And specifically for I Hope, when we started, a lot of the people that were around that initial table that we invited, right, in your community, low-hanging fruit, those gatekeepers, those, you know, when we invite them to the table, 3 years, 2 years later, when they started getting into positions in the community and they looked, they was like, oh, y'all still here. So it was that, you know, and they took our hands and when they started creating diversion programs down here, the day reporting centers, accountability courts, mental health courts. See, they didn't exist when we started. And so when they started creating those diversion programs, they realized nothing about us without us. They left out a really important factor in the rural community. There was no transportation. They created these modalities and nobody could get there, right? And so when we created that, that's when they started knocking on our door. Today, the mental health court pays us to take their people. So yeah, you know, just with that, that's how you build it. And you can't be I know my anxiety go up when I have to do a survey on myself or a survey on an organization. I'm like, oh, what people are gonna say, right? But when people give you back genuine feedback and genuine information, I think that is grounds for strengthening those relationships because they see that you care.
Thank you. Thank you. That kind of leads into one question that I had. So, you know, how do y'all track or how do y'all define success in your program? Like, what are the indicators that show you are making a difference in community? I know you said now that the accountability court is paying you to provide transportation for their peers, but what are some of the other indicators? Like, how do y'all define success?
I can, you know, go ahead, Tarusa.
Okay, well, I mean, that could come many ways. One is word of mouth, right? I still feel like that's the best. When we sit down and data is important. So we do annual, I'm gonna go back to the surveys. So our peers we survey. We give them out surveys. Tell us what we're doing, right? Tell us how we're doing, what we're doing. And so we do that so that it is, you know, formal, and then informal, just the reactions and the response. We had a peer tell us, I'm glad I'm part of a program where I never have to get discharged from. And that just blew my mind, right? And this person still comes, they show up, right? And so I measure it that way. So formally, you want to get the data, you want to be able to create a platform where people can, you know, say what they really need to say. And then, you know, just the way people keep showing up, the numbers show numbers of success. So quantitative and qualitative information helps us measure our success. And again, the last thing is too, when your community start knocking on your door and you start getting local dollars. I think because grants is there, you know, state grants, federal grants, but when you get businesses saying, hey, I want to sow into your organization, when you get those, you know, that helps me measure the level of success in the work that we're doing too. When you get the local mayor and like Charles had said, they come in and say, hey, let's collaborate. We the city, but we're not in a position to write for some of this stuff. So how can we come together and write for some of this stuff for our community? So yeah.
Thank you. Mrs. Sperling.
Well, you know, you got this whole notion of KPIs, you know, and key performance indicators, and in most contract grants, if you when you write them, when you say what you're going to do, those performance and those key performance indicators are there. You can write them. You can lay them out for yourself in your business. What would a key performance indicator look like? What would be that measure? So in Tarusa said earlier, so sometimes it's about quantity. How many widgets? How many people did you serve? You know, I served So even in field work, you guys know that we send these reports in to y'all every month about how many people, how many contacts, how many, so these are indicators of success. So when Samson is saying to the state, which, what are y'all doing with our money? So, we serve these number of people. So the quality comes in, how many people that you, provided homelessness services for, that you kept people off the street, how many people that you provided beds for, how many people you provided hot meals for, that kind of thing. How many families did you provide referrals for, and to where did you provide those referrals? So these are key performance indicators depending upon what your contract is about or where your heart track is about. Will help you measure your success. Because the other piece is that a lot of people will say, I know my program is successful, but the next question is, how do you know?
Right.
So that's a great question, and that's my contribution to that in terms of creating these measurements.
Thank you. All right, so we only got about 9 more minutes. So during the wrap up, can y'all please discuss what your call to action is for everybody leaving here? What do you want people to leave this webinar with today? What do you want them to be thinking? Mrs. Sperling, you can go first since you just was speaking.
Well, I'm about continuing the fight, expanding access to treatment services, to harm reduction work. Harm reduction works, and that's a clinical term that's been housed on the clinical side as well. But harm reduction is where we are right now. This fentanyl epidemic that we are dealing with, it is real, and it's affecting everybody. So I am wanting all of us to find ways to partner to give messages about things like fentanyl and drug addiction and that kind of thing, and finding folks in the community that would be able to work with you and making sure that you get those things done. I mean, when I say those things, I'm talking about the messages. Formulate the message. Make sure that the message is effective, and you can't do that, or you shouldn't do that by yourself. You should have somebody that's able to give you feedback. You need somebody in your circle whose opinion you trust, and is not afraid to give you information that you ain't happy with. and we need that. Ongoing policy and advocacy, training and mentorship. So I mentioned earlier, mentorship is absolutely huge. Succession planning, as Tarusa talked about earlier, it's going to be absolutely huge. And we need younger or people who, well, for me, younger folks whose mind and energy is at the level that they can run and chase some of the stuff that needs to be dealt with. So that's my response to that, Laree.
Okay, Mr. Sperling, can you just tell us real quick what harm reduction is? I don't know if everybody knows what that is here.
Well, so a definition for it, I'm blocking on a full definition for it, but harm reduction involves the fact that you are creating a situation where you are not causing yourself or your family or the community harm in your response to your addiction or your response to whatever behavior that is causing you problems. In other words, harm reduction would be MAT programming in some situations, right? MAT program is a harm reduction technique. In IV drug users, they say harm reduction is needle exchange. They say in HIV and AIDS work, they say that PrEP and PEP, those kinds of things are harm reduction techniques. And so all those things that would not necessarily eliminate, but be eliminate some of those things that are so harmful in terms of public health.
Okay.
Is what that is.
Thank you. Tarusa, can you talk about your call to action? What do you want people to do when they leave here?
Okay, so a couple of things. One of the things I want to allude to is I do want to harp back on to making sure that you're taking care of your personal recovery. because this work is heavy lifting. And so I agree with everything Charles said. So we're going to ditto that. And what I'm going to add to that is, right, that is essential, right? Making sure that you're taking care of your personal well-being, because this can be heavy lifting. And make sure that it's something that you are, you know, more than passionate about, but called to, because it can get challenging. Another thing I want to talk about on a practical level, which I've learned, is get to know, and I think it directly correlates with your personal recovery, is knowing who you are, right? I go through, I'm just 3 Ps real quick, right? Performance-based, process, or people, right? And I thought that was just really, really essential, because an action step means if you identify somebody who process and sometimes can get caught up in analysis paralysis, then that means that you need to link up with somebody else that to help you move that dial forward. It's not so much that you're not moving in, and we don't want nobody, you know, beating themselves up, but sometimes it's not about being a founder. Sometimes it's about being a co-founder, right? It's about getting together with somebody else if you're trying to do this work. When you really know, you know, who you are, we're all leaders in our own way, but that looks different, right? That looks different. And being able to succumb to whatever that is and how you identify it. If you're a people person, sometimes, you know, when you're going into, you know, peer work that intersects with your personal recovery, so you just need to have the right type of people around you that's going to be able to help you identify who you are and how you need to connect interpersonally, right, to move things forward. So I hope that helps. That has been huge with me doing this work and learning to identify when I'm looking for collaborators, relationships, when I'm looking for making new policies and procedures, how I'm disseminating information. And so, yeah, so don't get discouraged. And the last thing I want to say is know that you're worth it. Your self-worth. If you are absolutely enough to do this. Real short story. When I started working at the CSB, when I got my CARE certification, and Mr. Charles reminded me of this when he told his story about the degree. When I got my CARE certification, at that time I was working for the Community Service Board, and they had all of a sudden said, everybody need to put their degrees up. Everybody need to post them on the wall. Everybody, you know, because before then nobody had them posted up. And I went through some real motions, because even today I do not have a degree. I need to tell you guys that I am educated, and I do believe in development. I do believe in training. I do believe in that. I just didn't succumb to the 4-year process, right? But nevertheless, I went through some motions. And I'm like, oh my goodness, I have this CARE certificate, right? And this was a conversation between me and my higher power, the God of my understanding, right? And my Lord and Savior Jesus Christ. And it was like, count how many years you was in addiction. And I was like, well, it was about 13. And it was like at that time, well, count how many years you was in recovery. I was like, well, okay, it was about 11. It was like, well, you qualify. Put that certificate up on the wall. You have earned that. If that's all you got, it's enough. Your lived experience qualifies you, right? You definitely want to build on it, because we don't want to do no harm. But yeah, get to know you. And so then that will give you your next steps, right? Whether you're a leader, you're a founder, you're a co-founder, you're a co-leader. It is essentially about helping our community when we build in these organizations.
I don't think we need to say anything else. I think we need to leave on that. We are enough. Y'all, I just want to thank Mr. Sperling and Tarusa for coming and sharing their hope, their inspiration, their challenges and successes with us today. And hopefully they inspired some of us to start moving forward with some of the things that are in our heart to do. And so I just want to thank y'all, and I can't wait to hear from y'all again. I want to thank all the cares who showed up, the providers, the others, the team, everybody for being here and having a great webinar. I want to tell you again, you will receive your certificates. Give us a couple of weeks to get them out to you, okay?
Thank you,
Everybody have a great
Laree.
day. Thank
Thank you,
you.
Laree. Awesome.
Y'all have a wonderful day. Bye-bye.
All right.
Thank you, Tarusa and Charles. That was super, super
Thank you,
informative and
Reggie.
inspiring.
Yeah,
Yes.
thank you,
Yes.
Reggie.
Mm-hmm.
Yeah, all my peoples.
Yes, thank you. And it had some great questions, so yeah, thank you.
Yeah, awesome.
Thank you.
Tasha,
Hey, everybody.
what's up?
Bye-bye.
Let's
Hey,
go. Let's
sister.
talk about it.
Hey,
Hey.
Vanya.
Hey, Patrick. What's up,
Hey,
Patrick?
hey, Val.
What
What's
up?
up?
Hey, sister.
Hi.
Donald, what's up,
Hi.
Donald?
Look, I want to end it, but I don't want to end it
Hey,
while y'all
hey,
saying
hey.
bye.
I
Bye,
know.
y'all.
Donald, what's
Come
up,
on now.
Donald?
Okay.
Y'all ready?
Yeah.
Thank
Y'all know we
you.
got that Care Connect coming up. Y'all gonna be able to see each other March 7th. March 7th.
Okay,
I will be
Okay.
Saturday,
there.
May,
I'll
Saturday.
be there.
May
Bye,
Okay.
everybody.
20th.
All
I'm
right.
about
Bye,
to end
Mr.
it.
All
Reggie.
right.
Reggie.
Peace. All right.
Tasha, I owe you a phone
Vanya.
call.
All
You
Bye,
need
right.
to go
y'all.
ahead and call me
I'm
then.
gonna have to end this.
Okay.
All right.